Coming up today, breast cancer treatment can mean chemotherapy, radiation, surgeries, and much more. But one of the most critical parts of treatment is support. Today, we discuss why it matters and where patients and their loved ones can turn for help. Good morning, everyone. I am Jessica Lovell. Welcome to the Morning Medical Update. Every 2 minutes, someone learns they have breast cancer. And every diagnosis brings questions, fear, and uncertainty. People need a place to turn for help and hope. And today, we'll show you some great resources of support, both for breast cancer specifically and anyone living with any type of long-term health issue. Today, we are so glad to have this great panel with us today, including breast cancer survivor Tracy Mason. How are you?
Good. How are you?
Always good to see you. Thanks for being back on our program. You've been on many times sharing your health journey. So breast cancer has just been one of several, but you're going to share some good news about where you stand today. So thank you for that. Malia Opat is one of our social work caseworkers here at the University of Kansas Health System. She is sitting across from me. She helps connect patients with all of those resources out there in the community. And Lizzie Wright here next to me. She is the program director for Turning Point, an organization working closely alongside the health system to help support our patients. Always good to have you.
Thank you.
So Tracy, you were diagnosed in 2019. It was a rare form of breast cancer. Since then, you've needed heart surgery, you've needed brain surgery as well. Suffice to say that you've been through a lot. We know that. How are you feeling today across the board?
Well, I feel pretty good for the most part. I do live at the cancer center.
You said you live at Westwood.
I live at Westwood. Like every other day I'm there getting some sort of treatment. So, you know, it's going.
So what kind of treatment are you getting over at the cancer center right now?
Well, the primary problem is my potassium is always low. So I'm always there for like 5.5 hours getting some sort of treatment. And the chemo itself is every 3 weeks for 30 minutes.
But so far, you are cancer-free.
I'm
cancer-free. Rid from your body.
Right. They have kept, my oncologist gave me an awesome chemo. I do not have cancer anywhere in my brain, and anywhere, not even my brain, because I did the gamma tiles. I'm coming up on a year in December.
That's such great news. Great news, but you still have day-to-day challenges, like you said,
yeah.
Just getting to the cancer center weekly. Tell us a little bit about just kind of those day-to-day challenges and how you manage them.
It's hard to manage. With cancer, most cancer patients, we follow like a schedule. Like they tell you where to be, what to do, and how to do it. And so you just do kind of what you're told to do.
You're a good patient.
Yes.
Well, that's how you get better, is by listening to those around you who've done it before too, right?
They've done it before, and they're a lot smarter when it comes to, because even when I was diagnosed the second time when it went to my brain, my oncologist was like, well, I have 2. And I was like, you're making me choose? And she automatically was like, no, I can choose for you if you want me to.
And what was she having you choose?
My chemo.
Your different type of chemo?
Yeah.
Interesting.
Yeah, there was 2 I could have choose from.
So you've mentioned before that you've met there have been some good things that have come out of your diagnosis with breast cancer and your journey, but you've been connected with some amazing people along the way. Tell us about how you actually stayed connected and what you got from that.
My support group, like outside of the hospital, is the Breasties. The Breasties even have an app, and we have a local chapter as well. And basically there's chapters all over the U.S. But my chapter, like, you know, we've had like lunch together at some place. And the app is where we can go to like find our support group. Like they have support groups for caregivers, the patients themselves, if you're going through reconstruction. And for me, like I will join the Thriver group. Like if you're stage 4, you get to go to this group.
So how amazing is that? I mean, you go back 10, 20 years ago, you don't have apps to easily access these types of survivors and support out there. So that's really amazing, making it really easy and very specific to maybe exactly where you are in your journey. Lizzie, I want to bring you in here. You're the program director of Turning Point. That's such an amazing organization. First, just tell people exactly what Turning Point is and what kind of services you offer.
Yeah, so Turning Point, we're actually a part of the health system, but we're available to anyone in the area and beyond living with a serious or chronic illness. But we certainly have a lot of cancer patients who use our services. But COVID has kind of opened us up to be able to offer Zoom programs as well. So we're able to reach people in rural Kansas and even out of state. So, and our programs are focused on providing teaching skills for people to better manage their illness, whether it be cancer or any other serious or chronic physical illness.
So, and I love that. And one of the few good things that came out of COVID is being able to reach more people in places that we didn't think possible. So I want to put some information about Turning Point up on the screen. TurningPointKC.org. Sometimes when we think a patient's leaving a doctor's appointment with kind of a pamphlet in hand, you know, on where to go, what to do, what the next step is, feeling maybe a little alone. But how are you different?
Yeah, so that's exactly why we were created. We wanted there to be a gathering place for people when they did get that diagnosis and leave the doctor's office to be able to go and manage the stress and the anxiety and all the life changes that happen. So our specialty is providing a curriculum taught by anybody that's certified in their field. So we have oncopsychologists that teach, we have clinical social workers, and they teach patients that come how to better manage their illness. And it could be like meditation and mindfulness programs, it could be yoga if they're coming out of treatment and they're deconditioned. So it really, we have 90 programs in any given month on Zoom and in person as well. So really a patient can kind of, you know, find a program that fits their specific needs at that time.
And what kind of feedback have you gotten? What kind of results have you seen from somebody being able to really treat this from every angle, not just from a medication or a chemo or what we standardly think of when it comes to treating cancer, but really like mind, body, soul?
Yes. Oh, we see such a difference in folks, and they want to come and learn and connect with other people who are going through a shared experience. So we actually have some research that supports that our programs decrease stress and anxiety by a significant level, but it's so neat to have them, you know, connect with each other. And our standing facility is at 89th and State Line, and it's really, you know, calming colors. It's a beautiful space, a serene space. So when I worked at the Cancer Center, I would always tell patients, go over there and see what they have to offer and really try to find some good support programs.
Well, at a place you can walk in, it's not sterile. You're not. You're just walking in and feeling like it's your home, and it's a place that kind of belongs to you, and the people that go in there are just like you. Malia, I want to talk to you a little bit about what a social worker does for patients. And full disclosure, you two are very close, by the way, right?
Yes.
Yes.
Malia is my social worker.
Love it. Love it. I just learned that this morning, so I'm so glad we could connect you two. And tell us a little bit about what you do for patients like Tracy.
Well, social work role kind of looks different depending on the patient's needs. Some of patients need access to transportation services or lodging services, and we're kind of connecting patients to those community resources. Others we may meet one time and they don't need additional support. And others we're following, you know, for emotional support or guidance, kind of navigating life with a cancer diagnosis.
Because looks like. Yeah, I would imagine a lot of people don't know what they need until they sit down with you and go, oh, I didn't realize that transportation was going to be an issue because I'm going to have to get to the cancer center several times a week, like in Tracy's case. How long, what kind of relationship have you developed with Tracy, just to kind of know, like, that social work goes way beyond just the work, but it really kind of transcends into a friendship?
I met Tracy, what did you say, 2019?
Yeah.
Yeah, so I've been following her for a few years, yeah.
What are those conversations like when Tracy, you might need something from Malia, or Malia, you might have questions to make sure you're checking in on her?
I'll, like, every few weeks, I'll send her an email and say, hey, it's been a while, like, are you coming to see me?
It's only been 3 weeks, Tracy.
I know, and I'm like, I used to see you every time I came in here, but now I live here, so, you know. But I will send her a message, and she'll come in and either we talk about like whatever's going on or
In
if
life,
yeah.
not necessarily just cancer.
Yeah.
Just about managing and
Right.
coping and dealing with, you know, the experience of going through a cancer diagnosis, but also trying to have
Yeah.
an outside,
Yeah.
you know, a life outside of the
Yeah.
cancer center.
And she does that for me. Like sometimes when she comes in, I either talk about something bad that's happening or that I live there and it's getting too much and that kind of thing. And then sometimes it's more like, hey, what tennis shoes do you have?
Hey girl, what's up? I love that. Yeah. Well, and that's what I like having Tracy on, because she's kind of all in when it comes to being a patient. She's really connected with her healthcare and her doctors and the services that are provided. Malia, something that's kind of a pain is dealing with insurance companies, paying for these treatments. What kind of financial help is available for patients?
There are some local and national financial assistance that some patients may qualify for, so I'm trying to connect patients to see kind of what resources they may be eligible for. But there are a team of financial counselors that we rely on heavily to kind of help patients navigate the ins and outs of their insurance and what it covers and kind of answer all the questions, because it can be overwhelming.
And think about fighting for your life, and now you're having to fight insurance companies and trying to figure out where the money's going to come from, and it's something, I would imagine that's a huge burden to have to take off your shoulders. Tracy, what was that like? Is that a conversation you had to have?
I have had to have the transportation conversation because that's changed a bit in my life, especially with the potassium deficiency. Like when it's low, I really need transportation. And I haven't necessarily like gone the financial route with Malia because I have to say that KU has totally stepped up. Like I will call customer service about like a bill and they'll be like, don't worry about it right now. Like just do your treatments and we'll keep it on hold. And so basically I mean, KU has stepped up for me in so many ways.
We like hearing that, for sure. What about things like diet and exercise? Malia, Lizzie, both jump in here. Just kind of what, you know, we know doctors talk to their patients about that in clinic, but beyond that, we know there's a lot of resources out there. What can we offer?
There are dietitians that cover all the community sites. So patients, depending on the type of cancer diagnosis they have and the type of treatment they have, they may have different recommendations. So even our oncologists are relying heavily on our dietitians that patients can meet with and get scheduled with and continue to follow and get those recommendations.
So how long are you with you? You mentioned you guys have been together since 2019, but does it vary how long you stay with a social worker? And is everyone given a social worker at the start of their diagnosis and their treatment?
Everyone has access to a social worker, no matter what location they're receiving services at. I have some patients who I've been following for years, and I have other patients who I may have met one time. They didn't need additional support, so. But I'm always available. Every social worker, but there is a social worker for every team.
For every team, okay. And so is that standard across health systems and cancer centers where that kind of access is there and it's easy to get to and it's presented to people, or do they have to be asking for it?
I think it is presented for sure. Whether people access it or not, it's really up to the patient. But yes, our oncology teams and any physician knows that social work is available, and if something arises in clinic or something that they know that is kind of within the social work realm, we are being accessed.
All right. Before we move on, I just want to quickly remind our audience that you can ask your questions and maybe share some resources that you found in the community yourself. We want to hear them. We want people to walk away with all sorts of ideas on where they can go to get support. So you can use the chat on Facebook or YouTube. You can tweet us or email the Medical News Network. All that information is right there on your screen. Lizzie, it sounds like any other new programs that are happening in your world? What do we need to know? What's out there? What can people gain access to?
Yeah, so we are coordinating with the volunteer coordinator at the Cancer Center, and it's called the Breast Cancer Mentorship Program. And this is a program that's actually existed in the BMT world for a few years, and they found it to be really successful. But what it is the oncology team selects a patient they think would be a good mentor, and they have to be a year out of treatment. And they go through a training program to kind of learn boundaries and how to better support the new patients that will be matched with them. And then the patient can really say, I want to just email with you, or I want to get on the phone, or I want to meet in person. So they can kind of direct that relationship of
that seems
how they want it.
valuable. I mean, to see somebody who's gone before you, I have a feeling you will probably be a mentor at some point to someone or many, but how helpful is that when you talk to people who've gone before you in some of those outside groups that you're a part of?
It's almost life-changing to meet someone who is like you and who may have the same struggles as you, or even conversations. I've said this to my friends before. I said, I feel like all I talk about is cancer because it rules my life. And so I think the mentorship program sounds awesome, because if we're able to help just one person, that's enough for me. Like, if my story helps just one, I'm good.
You've done your job.
I've done my job.
You paid that forward. Let's talk about some other groups that are independent. You're affiliated with, like it's Gilda's, is it Gilda's?
Yes, Gilda's Club, KC.
Yeah.
Yes.
So just some other areas, I like to mention them so that people can see these on the screen as well, but how you connect with them and how useful and helpful they've been.
Yeah, so Gilda's Club, they're a national organization named after Gilda Radner, the comedian, and they're here in town, like right in between the Plaza and Westport, but they do Zoom programs, in-person programs, and they're one of the only places in town currently that has a breast cancer specific support group. And then Cancer Action is an amazing organization here in town. They offer prescription assistance, transportation help, wigs, emotional support. They do it all. And then American Cancer Society, of course, is another national organization, but they have a branch here in Kansas City, and they do a lot for folks with wig assistance, financial assistance.
And we must mention Missy's Boutique over at Westwood. Have you popped in there and utilized their services? I'll let you kind of tell folks how they help and what they've done for breast cancer survivors.
Missy's Boutique has a ton of like wig options that you can do. Because,
wigs, bras, you name it, right?
Everything. And because, believe me, you're thinking, oh my God, am I gonna wear a wig? Am I not gonna wear a wig? Do I want a hat? Because they have,
scarves,
Missy's Boutique has everything, like the scarves, the hats, the wigs, you name it, they're there to help you. And because one of the first things that you get, well, I got from my oncologist was a prescription for a wig. And I was like, I'm not using a wig. Like, I don't care about how I look. Like, thank God I had a good shaped head.
I think this is the shortest I've seen your hair. I like it.
Yeah.
I like you wearing your hair short like that.
It's growing.
But that's a really good, interesting point. When you start into a cancer journey, I'm sure losing your hair is something that people think of immediately. And making that decision, do I want to wear a wig? No, want to wear a wig? Just questions that you don't really think that you're going to have to be faced with, right?
Right.
So Tracy, you had told us before that there were days in treatment where you just kind of felt like giving up. I'm done with this.
Yeah.
What advice do you have for someone who might be feeling that way today?
Give it time. I mean, I live at Westwood 3 days a week, and that is hard. And sometimes talking it through with someone is all I kind of need. I just need to vent. And whether that be to Malia, who I'll call up and be like, I want to vent. Or, it could be my support group or, whatever. I just have to get it out. That is my source of, I'm tired of being here. I need a break. And I need to vent.
Venting is good. And
Venting is good.
Yeah.
Yeah. Getting it out, like whatever the problem is tremendous.
And safe space.
safe space.
It's a safe place.
Exactly, and people who know what they're doing. And it
Yeah.
seems like everywhere you turn, you've got someone
Yep.
willing to listen and come up with some sort of solution.
Yep, I have Malia, I have palliative care, I have my friends that unfortunately have cancer. But you know, you can talk to them about anything because they've been through it with you. You know, so
So we're going to get to some questions. We've got a few coming in. Dr. Hawkinson has the day off today. We let him do that every now and then, but we'll see him back here on Monday. So let's get to some community questions. And Jenny just wants to say thanks again to Tracy for sharing a piece of your life in order to help others get through a life-altering diagnosis of cancer. So just wanting you to know that people are saying that and appreciate you. Paul says, what types of resources does Turning Point have, and how can the community or an individual help? And kind of on that, Jeremy wanted to know kind of what are some of the popular courses and classes that people take at Turning Point?
Sure. So we have, our calendar comes out 2 months at a time. So we have our November, December one out now, and they're different categories. So meditation, mindfulness, emotional, physical support, body movement or exercise programs. I'd say the most popular ones, at least at the beginning, are the body movement programs, because I think they require a little less sharing, and maybe you feel a little bit more comfortable taking a class with people who understand what you're going through. And then the emotional support classes, we have art therapy. We actually have a women's sexual health class coming up that's taught by one of our oncopsychologists, and it focuses on body image and those things that we talked about, all the changes that are coming with cancer treatment and how to manage that. So yeah, it really, there's something for everybody.
Do you sign up, or can you just go on, click and peruse and pick what you want to do?
Yes, we have a great online registration system now. So, and to get that, you can do a short intake form on our website, turningpointkc.org, or you can email us at turningpoint@kumc.edu, or call us, and we will get you set up.
Get you in.
That. Yeah.
I love that. Yen has a question for you, Tracy. After successfully treating breast cancer, have you made any efforts in terms of exercise or lifestyle adjustments to prevent recurrence? Have you, just what does life look like now for you on the day-to-day as far as changes?
Well, with the potassium problem, I try to eat more potassium-rich foods to try to keep me out of the hospital. And I do physical therapy, and that because most people think that cancer patients, we're like, we look emaciated, like we look, but some of the meds will make you gain weight, like the steroids and that kind of thing. So physical therapy is great, like movement is great. So I do all of that.
So we have a show next week just talking about, kind of body image, and
Right.
After you've gone through the therapy and the treatment and the reconstruction, there's just so many layers to it. You said that just wasn't important to you, kind of what you look like.
Right.
You took that off the table, something you don't have to worry
Right.
about. But how do you, or what advice do you have for people struggling with that body image and just their their self-care?
You already have cancer, so what that looks like is different for everybody. Like, do you care about your weight? Do you not care about your weight? Do you care about laying in bed too much versus getting out of bed and like doing something? Like my rule of thumb, because Malia found my therapist, my oncology therapist for me, and she makes me get out. She's like, you have to get out and do two nice things, like out of the house, like with non-cancer people. And that's great for like that mental side.
So she likes you to get out and do stuff with people who do not have cancer.
Right. Yeah.
And are you doing doctor's orders? Are you doing that? And are you trying to? I'm not sure, not every day you feel like it, but
I do. Like, palliative care will be like, I want you to do this. And, you try to do it. It's getting colder outside, so it's going to be harder. So, you just gotta, I don't know, I have a different attitude when it comes to cancer. Like, you just get up and go. Like, pretend your life is normal, that you do not have cancer.
Get up and go.
Get up and go.
That's a good slogan. Terry has a question, Malia. Do social workers ever have to set boundaries as you get close to cancer patients, or maybe cancer patients that don't have the support or the family? You become family in some ways and friends.
You know, a core value, I think, as we've learned just basic social work when you're going into this, is making sure you have good boundaries. That's kind of how I can thrive at work and then go home.
Finding the balance.
Yes, there's time. There are patients I take home. There are patients that have made me shed tears, and there's patients that I get close to, for sure. It is, that is an everyday issue for many.
But that's why you do what you do. That's why you're good at what you do, for sure. Question about, Wendy wants to know, does insurance help cover the cost of wigs and bras and things like that?
There are many, there are some commercial plans that will help with the coverage for wigs. Most insurance will help with post-mastectomy supplies or special bras. Missy's Boutique is really good about kind of assisting and navigating that with patients as well.
What's covered and what's not,
yes,
as it should be. A question, what's the biggest misconception about living with breast cancer that, Tracy, maybe you hear from people?
Most people think I'm living in bed and not doing anything, and that is completely untrue. Like, I live my life. I mean, nobody knows how they're gonna die, or, you know, nobody knows what's going to happen to them. So you get up and you live your life. You join a group, or you go to like Turning Point, to like an in-person event. It looks like what you want it to look like. You know, because some people take on the cancer and they want that cancer attention, like, oh, I have cancer, you should do this or that for me. But really, once you're on a schedule, you just live your life.
Live your life.
Live your life.
Tomorrow is never promised.
I mean, who says I'm going to die of cancer? Like, nobody.
Nobody.
So
get up and go.
Get up and go.
That's what you say. I want to get our takeaways today. Malia, I'll start with you. For folks who are watching who may be going through breast cancer or any type of illness, long-term illness, or may be diagnosed down the road, what's the biggest takeaway you want people to know?
Don't be afraid to ask for help and use your support system. Cannot get through a cancer diagnosis. I mean, each of us cannot go through life by ourselves without using supports. So use your support system. Do not be afraid to ask for help.
And know that people are out there trying to make it easy for you to get in contact. I think a lot of people feel like, oh my gosh, how many phones am I going to have to pick up, and be redirected to this person and that person, so they may be deterred to pick up and call. So make sure you're utilizing the access that's available to you. Lizzie, what is the biggest takeaway from this conversation, and what you want people to take away regarding what is out there as far as the resources from Turning Point?
I just want to say there's no, one size does not fit all. Everybody is different. Everybody's an individual. Some people want to go to support groups. Some people don't. So there's just no right or wrong way to seek out the supports that we talked about. So I would just say, just be graceful with yourself and kind of tune into what you think that you need, and I'll echo the ask for help.
Ask for help. I love, though, that you've presented like this menu of different things and places to go, whether it be online, in person, different classes, solo, as a group, all sorts of great things. So thank you for your services over there at Turning Point. Tracy, I'm going to let you tell us the biggest takeaway of today. What do you want folks to know?
That there is places to go for help, and you can't do it alone. Cancer is a lot to deal with, and so at KU we have our social workers, our nutritionists, our physical therapists, our everything you can think of, and then when we go home we have Turning Point and Guilds Club, and hey, I want to take this art class tonight. And during COVID, it was like you picked up your supplies and you went home and you went on your Zoom and you painted, or you made rocks, or you did something. So there's all kind of avenues to go to when you have cancer. Like, don't do it alone. I thought I could in the beginning. Malia will tell you, I was like, I'm good. Like, I'm good. Until one day I broke and was like, I want my social worker.
You're like, I'm not good.
I'm not good.
But doing it alone, I think that's something a lot of people go into any sort of challenge. I got this. I got this.
I got this.
And it's okay not to have it on your own.
It's so good not to have it on your own.
Thank you so much for always being with us and being open with all of your health story. And
Yeah.
we love having you.
Thank
you. Thanks to all of our guests. And thanks to our viewers for being with us today. Coming up on Monday, we meet a former chaplain at Children's Mercy Hospital and ask what happens when cancer treatment ends up causing more cancer. That's Monday at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.